there's something really wrong about how we deliver healthcare. There's so many things wrong here. However, the hope that we have is that this country has invested in a generation and several generations of people who truly desire a change. My name is Dr. Femi Olaleye, the Medical Director of Optimal Medical Center, also the Founder, Chief Executive Officer of Wish for Africa project. It's a combination of two organizations, a non-profit organization and a for-profit organization designed to help make our people have access to affordable healthcare, because each one alone on their own cannot do it. We're really glad that today is a day we picked out of the calendar to do something nobody has ever tried to do before. What is going on here? We partnered with a very big organization, the UBA Bank, and through their foundation, they collaborated with us to offer the people in this community an opportunity to have access to affordable healthcare. But this first element of today is that they will have it free. Hoping that if after today about 500 of people in this community will have access to free healthcare, those who normally don't have access to care because of money would have been given the opportunity to walk through these doors today, have access to what they thought was expensive, what they thought they couldn't afford, through the glory, the grace of UBA and the grace of God.
My name is Gloria Brima Imokweda. I'm the Education Program Manager for UBA Foundation, and I'm also the project coordinator for this project, for the Wish for Africa Free Medical Mission project. UBA Foundation is the corporate social responsibility arm of UBA Group. It is reckoned to be the heart of UBA Group. Today is a beautiful day. We've never done anything like this before. We're all excited. It's a free medical mission, and we partnered with an NGO, a diaspora-based NGO. It's called Wish for Africa project, and it's a free medical and surgical mission to members of the Mafoluku Oshodi community. And when Dr. Olaleye came to us with this initiative, we're really excited because we could see the impact straight away. You're reaching a large number of people in the community, and you know that the impact will be felt and the memories will be lasting. And this is one of such initiatives we were hoping will be a springboard to many others that we will do like this.
By 10:30, 11, we should be ready to open our doors only to those who are registered.
It allowed us to see that there are about 195 adults who want to have treatment for things as serious as diabetes and hypertension, but they are keeping it at home. So those as mild as body pains, headaches, and we had about 60 registered to have their eyes checked as well, because we've got 2 optometrists coming later on today. Once they've identified they've truly been part of the registered, we will ask them to go in and take a number. We start from 1 to whatever they finish, and in batches of 5 we will take them into the hospital to see the respective doctors. As you can imagine, there's a lot of activities going on in our very small unit. So what we've tried to do is do what they call a just-in-time. You arrive in front of the doctor just in time for the doctor to see you, get your medication across to you, and then you can go out of the premises so that others can come in. So if you can picture a conveyor belt moving patients from one department to another, as they've seen a doctor, they will exchange their voucher for a prescription note from the doctor, which will be filled in our prescription, drugs already stocked from the funds provided, Some of the pharmaceutical companies we've approached have responded admirably and very generously to our appeal. Once they've collected their drugs, we'll give them some gift items. They will get all this, and then they're on their way out. We have about 45 volunteers today, and having told a lot more are coming to help, because everybody really, truly, we have a compassionate part of us that wants to do something good.
My name is Okechukwu Duru. I'm a resident doctor with Lagos University Teaching Hospital. I'm a general surgeon.
My name is Dr. Timothy Oluwatu Ibamigboye. I'm the medical director of Anointed Medical Diagnostic Services, Mapoluku, Oshodi.
My name is Ayokunle Lokoyo, and I'm a staff of BAPLC, Ilorin branch, Ilorin 3. I came all the way down here to participate in this laudable initiative.
My name is Mrs. Aderonke Aregbeshola. I have with me my daughter, Mrs. Olayinka Aregbeshola Ubuntimu. She's here to support Wish for Africa as well.
My role to this is to carry out the minor surgeries that the patients that we've seen, we've assessed, we've done the pre-op assessment, and most of them were mainly hernias. We have some hydrosis that we have, and also we have some lipomas. So these are minor operations that can be done in an outfit like this and within the circumstances this provides. They will be done under what we call local anesthesia. It's not the one the patient will go to sleep. The patient will be awake, but we will give injection that will make the place not be painful during the procedure. The patient will go home today. He will stay in for observation for about 2-3 hours, then the patient goes home.
You have people in Mapoluku, which is a low-income area, who cannot afford basic hospital bills. And when you have a private partnership of this nature coming up to help people, I think doctors should come up willingly to do that.
We had 390 people registered. So that register allowed us to break down the conditions, and we ended up having 4 major units. We have the 20 surgical patients I mentioned earlier, and that's how I got the numbers of children, 55, which again allowed us to know how many of them are male, how many of them are female. It allowed us to work out, statistics like how many are below 2, how many are below 5, so that we can have a range of what's the disease prevalence among this age group of children in this community.
My name is Miss Ngozi, Mrs. Ugu, and my son's name is Melody Ugu. I have come to find out what is wrong in me. So to my baby,